Dr. Jen Kilgore. I'm here to show my competencies on the Basic 7 after taking the Basic Core Pump Certification course with Sam Colby. So we'll just go ahead and get started.
Yep.
I'm going to start with the yins, which is the first move. We're going to step up onto the platform. You'll notice that right away I'm putting my heels off the platform. So my toes are on, I'm nice and stable, but my heels are off. I'm going to come down and grab the handles and come back up, and now we'll just lift. And I come down and all the way up. At the top here, I can add a little extra trap shove if I want to. And then we can move on to our bakers. So bakers are going to replace our back row here. Just going to take the handles and go out a notch or two on both sides. And then we want the legs straight in a jumper stance with a bend at the hip here and a nice stable low back. We're going to grab the handles and just lift the elbows, keeping the alignment in the back so we're not straining the low back as you do your back row and your chest press. Okay, we'll move to our deadlifts now. Here we're going to keep the same stance, jumper stance, bend at the hip, nice straight spine. We'll grab the middle bar, keeping the legs straight. We're going to activate the glutes and come up, and then activate the abdomen on the way down. We'll move from here into a paraspinal move called setos. We're going to be working the muscles right along either side of the spine. So we're going to stay in the platform. We turn so we're still stable on the platform. Legs are straight. Nice spinal alignment. Come down and grab your handle, and then a little side bend. We're just barely breaking the midline plane. And you can do that on both sides. Come down off the platform. We're going to try our slaughters here. This is the seated shoulder press. Here we can come up and then pull down. We're going to move right to our Zaccardos. And here you can sit on the platform, let your feet fall kind of naturally. Grab in front. You want your elbows tucked close to center. You can also grab even more tightly here is fine. As you stand up, your feet should come down and you're in your squatting position. Stand up and pull down. And we'll finish with our bicep, tricep. You can see you're getting bicep on the way up and tricep on the way down. We're trying not to top out or bottom out anywhere.
Perfect. So the next part is your ideal patient that you would want to treat with a specific core pump scenario, routine. You don't have to do the full thing, just explain it and maybe give a couple of just demo reps.
Yeah, right now my ideal patient is going to be the patient that has trouble exercising on traditional machines because of neck pain. Specifically the junction between the cervical and the thoracic spine. This is a spot that can be very easily irritated in patients with cervical stenosis or anyone that has an anterior head carriage, meaning the ears are out in front of the shoulders. on a posture exam, you know that that head is being carried and it's feeling like a lot more weight on this area at the junction. So we're gonna try and unload that while we go through this same basic 7. This patient would likely start on a setting 1 and could probably go through the 7 exercises just like I demonstrated at that level. The adjustments we're gonna make to a few of these exercises will hopefully allow this patient to start going up in resistance without stressing this area and causing a flare. So we're gonna start again. Let's go back up on the platform. We'll set for what would be yins in the basic moves. And for the rehab here, we're just gonna turn and grab from behind. And it's okay, you can bring the heels off. It's okay if they don't quite make it all the way off. And then we're gonna come up and down doing the calf raises, just like in your traditional yin. But here, you don't have to do the trap shrug, which can activate that area we're trying to avoid irritating. And you can still get your calf raises. And actually this feels so much more like the neck is not doing as much work here, so it can actually increase this resistance right away in most people. So then we'll go to our bakers, and we're traditionally going to be doing the bakers like a back row here, but what we're going to do is just reverse that. So same thing, we're going to take the same move, same handle position, turn all the way around, and instead we'll avoid activating the upper trap and work a little bit more on the lower trap. Okay, your deadlifts and setos, we can do the same way we've been doing. So we'll still take this patient through all 7 exercises. So they can go ahead and do the deadlift. They can do the setos, which is that paraspinal move. We're not gonna make any alterations there. And then we're gonna go into the slaughters where we have the seated shoulder press. And we're just gonna do a supinated press. So if you remember, we were right here for shoulder press. So handles are out and we're working in front. For this patient, to keep that pressure off the neck, just gonna go supinate, grab, and do the same move, only now I don't feel my upper traps taking over, and I can do a little bit more work without stressing that C7, T1 junction. The squats are gonna be the same. There's really no need to unload here, so we can do the zaccardos just like we would in a normal basic. And then we're gonna go into our bindles. And instead of the bicep and the tricep, we're gonna do a pulsing bicep tricep, which avoids, again, activation of that upper trap and irritation at C7, T1. So it's controlled, a little different than ballistic, we're just pulsing. Very controlled movements so that the upper trap doesn't get tempted to take over.
Now with that routine, what frequency, how long would they spend on each circuit, and how many circuits would they do, and what frequency would they do it, weekly, monthly, that type of thing?
Yeah, I think for any kind of rehab for the cervical spine, initially you'd want to be doing it with a rehab specialist at least 2 times a week, ideally 3 times a week if schedule allows. Getting on to do the basic 7, a minute each with the reverse yins, reverse bakers, J-jack setos, supinated slaughters, zaccardos, and pulsing bindles, and some stretching in between. So we'll work on some lengthening moves as well. So in between each minute, we might take some time and do a little bit of stretching this way or this way. You have to kind of help me with these, right?
Yep.
Yeah.
And that first one is probably just a really nice,
keeping it nice and open.
Nice basic.
You can go into some of these and start to get a little bit of anterior chest opening. So we'll be integrating some stretching, but absolutely 3 times a week, full minute, at as resistance of 1 initially, and then you build up using the reverse yins, reverse bakers, supinated slaughters, and go from there.
Now, as far as a machine go, how has the core pump machine, or how will the core pump machine, because I know you were talking about putting several of them in your actual office and maybe even at home.
Yeah, absolutely. Yeah, for me, I mean, I do a lot of foundational work, trying to help folks that aren't experiencing optimal health build a foundation for that to occur. So we're always trying to remove obstacles to someone's ability to heal. And in rehab, that means looking at the spine, looking at the posture. The posture tends to be a window into how the spine is functioning. So we're going to be doing posture exams. For this patient, we're going to pay really close attention to that anterior head carriage and watch that correct as the cervical curve comes back and as the muscle length tension relationships to support that come back together.
Perfect. Well, awesome. That was it. Good job, Jen.